All right. So I think it is time for us to start. Hello, everyone. My name is Martin Karcsy from the Central European University, and I'm going to be your chair this afternoon. This is the COVID-19 one session. We are going to have 4 speakers. The first one is Alain Barrat from Marseille, who is going to talk about effect of manual and digital contact tracing on COVID-19 outbreaks, a study on empirical contact data. So this session consists of 4 50-minute talks. So I would like to ask the speakers to wrap up after 12 minutes. And if anyone has questions, you can put it in the chat, or I assume you can also raise your hand during the talk. So Alain, this is the floor is yours now. You have 12 minutes.
Okay, do you see correctly my screen?
Yes, we do see it.
Okay, and the mouse?
As well.
Okay, so I will start. Thank you very much. So I want to talk to you about work we've done with Ciro Cattuto, Mikko Kivela, Sune, Lehmann, and Jari last summer. And you can see it on this medRxiv preprint. And so it's about, indeed, manual and digital contact tracing on COVID-19 outbreaks using empirical contact data that has been collected that I will introduce. So it's probably not very, not really needed to tell you that about the COVID crisis. We're all home instead of at a nice conference because of that. So in some countries, we are in a second wave. In other countries like US, the first wave never really ended. And for instance, if we look at what happens in France, where I live, so the first wave was successfully stopped, well, contained, thanks to very drastic lockdowns in many other countries as well. And now, once again, we had to enter a lockdown, which is supposed to end next week, even if it's not as drastic as the first one. But it's obvious that we need also strategies for after the lockdown is lifted in order not to have suddenly a third wave coming up, especially since now we are in winter, so people are indoors and we don't have the favorable conditions of summer. So from that point of view, it's known that obviously you need to test as much as possible individuals, but it's also known that just testing people who have symptoms is not enough. And the reason is that if we think about a case who becomes infected and then starts to develop symptoms at the symptom onset, then in some diseases like SARS in 2003, the contagion period, the period in which the person is most infectious, is after the symptoms come out. So it's much easier to detect all the cases and to stop the spreading. But here it has been documented, in particular, this figure comes from this paper in Nature Medicine, that people are contagious before even showing symptoms. In addition, we have asymptomatic people who also are contagious, but in particular, we have a large number of contagion before in the pre-symptomatic stage. So it means that just testing people with symptoms is clearly not enough. And that's where contact tracing comes into play, because basically you, once somebody has symptoms, you try to look at what happened before. And so you start to look for people who have been in contact with that case, and so might have been already infected when you detect the case. So it's in terms of usual contact tracing, that's a pretty standard thing actually for infectious diseases, and it's typically conducted by interviewing people. So you ask someone who is a case, who have you met yesterday? Who have you met 2 days ago? And so you have a number of the contacts who can be contacted by phone, by email, usually by phone. And so those persons, you can warn them and ask them to quarantine. Among those, some will be, again, isolated because they have become, you can test them, they have become infectious. Other, you will just quarantine them because they could be in a exposed, latent stage, not yet been detected by tests. And so you ask them to quarantine for a while. So it's known that this works basically, but it's time consuming. You have to interview, and typically nobody can remember all the people one meet every day. Some people you just don't know them. I mean, you take public transportation, you go into shops, etc. So it misses a number of contacts. Because of that, it's been argued that it could be very interesting to use automatic tracing using apps. And so this is the idea that a lot of people have smartphones. So if you manage to have an app that detects contact, then you could do contact tracing automatically. Obviously, there are technical issues, among which the signals that are used are Bluetooth, which lack precision in terms of distance, but you have also ethical questions, such as the problem of privacy and data protection. So fortunately, a bunch of people, especially in Switzerland at the PFL, proposed a protocol which is called DP3T, and then has inspired the Google Apple exposure notification system. Basically, people who have a smartphone with the app installed, they emit random identifiers. They collect the identifiers of neighboring phones. And if an individual who has the app is detected as infectious, then he or she will upload the identifiers it has been emitting in the last days, and then another person can identify that he or she has been in contact with that infectious people and be warned to please quarantine, contact health authorities, etc. Okay, does this work? So there's a very famous paper that in March of this year that used a mathematical mean field framework to show that in some conditions it could be effective, meaning that the rate of increase of the disease could become negative. So this would be the green part in the diagrams, as long as there are basically no delays and the success in isolation is large enough. So there were a number of claims in the press, not in the paper, about a threshold of 60% adoption, and in the press a lot of things were misunderstood about this. In any case, this was a mean field approach, and so it's legitimate to ask what happens if we take into account realistic properties of contacts. And to do that, you need to use real data. You need to use empirical contact data, which turns out a number of groups in the last 10 years, 10, 12 years, has been collecting in various settings and making public. So one of these is, of course, our work in sociopatterns, in which we have published data sets about contacts in many different settings, such as schools, offices, hospitals, etc. And also a bigger data set from the famous Copenhagen network study, which collected data with Bluetooth, so very similar to the actual contact tracing apps, among university students in Denmark, and the data has been made public last year for 1 month of data. So we use this data, and so which show how people interact in the daily normal life. And we can simulate the propagation of a disease on this data and then look at various interventions. So we did that with a standard model for SARS-CoV, in which we have a susceptible who can be infected and become first exposed. Then we have a pre-symptomatic infectious stage. And then infectious people can become asymptomatic, mildly symptomatic, or severely symptomatic. So severe symptoms are detected, and mild symptoms can be detected with a certain probability. And on top of, and of course, severe, if people with symptoms are detected, they are isolated, and their contacts are traced, possibly by manual or digital contact tracing. And we have a few parameters. How do you define contact to be at risk? So that's a length of contact, typically 15 minutes in usual apps. And we have two other parameters, main parameters, which are how much each individual will recall of his or her contacts in the past days. So that's a fraction of this at-risk contact that is recorded, and how many people have installed the app. Because to use digital contact tracing, you need that both the case that has been detected and his or her contacts carry a smartphone with the app. So we can investigate how the efficiency works as a function of these parameters. And here we look at the reduction in the final epidemic size when we have this disease spreading in the population. And we see that with the manual contact tracing, we have basically a more or less linear behavior. But for the app adoption, we have only a quadratic effect, meaning that the reduction is very small for low app adoption, but we don't have any threshold, which is kind of natural, but it needed to be made quite rather clear. As soon as you have a bit of app adoption, you have an effect, but obviously it's a bit small at small app adoption. And we have a behavior that turns out to be very robust across data sets. And here I just show some slices of the previous 3D plots. So we see that if there is no manual contact tracing, the efficiency is growing slowly, it's quadratic, whereas it's growing much faster if we have manual contact tracing, even if we have some delays in the contact tracing. Another thing you can investigate in this kind of modeling is the cost in terms of how many people you quarantine and how many you quarantine wrongly in some sense, meaning that they are warned, but they were not infected. That is unavoidable, obviously, with this kind of strategies, but it's still much better than a global lockdown. And we see that we have this parabolic shape in which if the policy is very effective, then actually we stop the spread early enough, and then we have a cost that decreases with the benefit. Interestingly enough, we have actually managed to work out analytically on a simplifying model, like an SIR, instead of this more complex COVID-like model, on a static network, a random static network, that we have the same kind of phenomenology, so linear benefit in the manual contact tracing and quadratic in the app. We also managed to check what happens with a recursive, so looking at contacts of contacts, and just to make it quick, you have some benefit, but it's small, and there are very strong privacy concerns, so which would risk a lower app adoption. So to summarize, contact tracing with the app can only be a complement to manual contact tracing, because even if we don't have a threshold, it's a quadratic behavior. Our study has some limitation, obviously, and so that's why also we had some other works with a large-scale agent-based model that will be an invited talk on Thursday, and also another model that improves on the Ferretis paper fed by simulations, and that will be shown in a satellite on Wednesday. That's all. Thank you for your attention.
Thank you very much, Alain, for the great talk. Is there any question? If not, I can start with some questions. So you are using two types of data set. One was collected by Bluetooth, the other is by RFIDs on a rather small population in a rather specific setting, whether in classrooms, hospitals, or museums, etc. How do you think your results would generalize if you would let it to the wild? So when, for example, you would trace the contacts of people on public transportation or in general?
So obviously that's a very big limitation, which is, I mean, it's the kind of data we have. So what gives us some confidence in the qualitative behavior is that in the results with the group of Chiarapoletto, which is a much bigger agent-based, it's an agent-based model. So it's not data, it's synthetic data. So also there you have a model of how people interact in the wild, but you still have the same phenomenology. So I would think that there might be some additional effects, such as due to, for instance, assortativity of contacts, the fact that you repeat the same contact more or less every day, and the fact that the app would maybe work better than manual contact tracing for those contacts that are more random, like in the transportation. So that, but you still expect something quadratic, because I mean it's been claimed in some talks that it was a linear effect. It just isn't. I mean it just can't be linear. It has to be quadratic because you need two people to have the app. So the best scenario is quadratic, and then you can have coefficients in front, of course.
Thank you very much. Any other question? Please write on the chat or raise your hand. I really tried not to miss anything or anyone. All right, if it seems there is no more question, in this case, we move on. Thank you very much, Alain. We move to the next speaker, who is Fabio Bento. And the talk is on a behavioral perspective to community resilience during the COVID-19 pandemic, the case of Paraisópolis in Sao Paulo, Brazil. Fabio, it's yours.
Thanks, Martin. Thanks, everyone, for attending. My name is Fabio Bento. I'm an associate professor at Oslo Metropolitan University. And what I'd like to present to you today is what we have learned about community resilience from following the experience of the community of Paraisópolis, which is a favela, is a very poor neighborhood in São Paulo, Brazil. We present here a descriptive analysis, a very interpretive study. We have a few assumptions I'd like to share with you at this point. We usually think about the effect of different policies, about policy making in terms of promoting and sustaining social distances and different policies in their effect in controlling the pandemic. However, from the perspective of complex systems, it's very important to look at the emergence of practice at the community level, of how people in their own social environment self-organize in order to cope with some environmental perturbations such as the pandemic. So we look at the case of Paraisópolis from a complex systems perspective, which means that we look at the decentralized emergence of different practices and behavior at the community level. And we know that's pretty much the case that policies, public policies sometimes fail to work even when they have great intentions, because they don't know how people pretty much behave and how they produce knowledge in their own local environments. And we know that we need to look at the dynamics of robust social web of interactions and knowledge emerging from these. A little bit more about our case. I mean, Paraisópolis gained a lot of media attention in April and May as an example of successful community response to the pandemic. At that point, the favela had an infection rate which was less than half of the overall city of São Paulo. And considering this a poor neighborhood, that was regarded as, in many ways, an example that other communities could follow. We know that low-income social groups and urban settlements are more exposed to risk brought by the pandemics, and therefore we thought that Paraisópolis was a very interesting case to look at. As I said, I mean, there was an infection rate which was 21.7 cases per 100,000 inhabitants, which was very much lower than the 56.2 cases per 100,000 inhabitants the city of São Paulo. And what we observed in Paraisópolis was a combination of different emergent practices from the civil society that has been implemented to fight the spread of the novel coronavirus. The picture I'm showing you now is actually on the left side, you have the community that we're researching. On the right side, you see the wealthy district of Morumbi in São Paulo. And the picture shows a context of high inequality. There's a high inequality. It's a poor neighborhood surrounded by wealthy neighborhoods. And that's a great representation of social inequality in the Brazilian context. And all that in the context of uncoordinated and sometimes incoherent policies at different levels, at the city level, the state level, and the federal level. Policies ranging from promoting social distance to even denying the pandemic at the federal level. We think about complex systems as process-dependent organic entities, which are characterized by feedback among multiple scales and agents. And we work with behavior analysis, which is sometimes a branch of psychology or a science in itself, which has looked at the evolutionary continuity in how organisms discriminate environmental cues and change behavior as a function of consequences. In behavior analysis, we have a concept called meta-contingencies, which expands the conceptual repertoire behavior analysis from the individual to the group level. So we look at aggregate products of interlocking behaviors and take a look at these at aggregate behaviors as a function to a selecting environment. Interlocking behavior contingencies, we have an aggregate behavior, and we have a selecting environment. And we can expand that from the individual to the collective level. This is the case of São Paulo. We have tried to analyze what's called the cultural milieu, which is a combination or a mosaic of different stimulus from the environment. We have the geographical boundary with location is the context of inequality, poverty, and populational density. We have the psychological environment, which is the economy, political, lack of stated support, the ecological boundary, in that case, the pandemic in itself, as an environmental perturbation. And all that represent a very complex mosaic of environmental stimuli to behavior at the individual and aggregate level. We have a descriptive analysis, which means that we were originally intended to conduct an ethnographic study. We'd love to have visited the favela to conduct observations and direct observations of practices. That was not possible in the context of the pandemic. We're located in a different country. It was difficult to travel and conduct observational kind of research. But we gain information through previous publication, research reports, media material, and interviews with community members that we conduct through WhatsApp and different kind of communication tools. And by doing that, we look at the cultural milieu and we're identifying some levels of resilience as suggested by Folk 2006. We get our data in a temporal perspective. We look at the interplay, disturbance, and reorganization, adaptive capacity, the systems feedback, the cross-scale dynamic feedbacks, and we reflect upon the continuity and maintenance of behavior in a post-pandemic future. So the São Paulo cultural milieu, that's pretty much how it looks. We have social inequality, disorganized and incoherent public policies, delayed response by the pandemics, and at some point the favelas start to receive news about the pandemic as it was spread around the world, and that was the moment they realized they had to act, not only wait for the state, for the governments, but pretty much act in themselves. We have small households, an increase in unemployment, and what we initially observed was a totally reorganization of different structures that were already in place. So our first finding was that resilience did not come, as something that did not exist before. There's a system capacity that has to do with previous experience, open channels of communications, and a whole set of reorganization of different practices that already exist in the favela. We have, for example, a restaurant that was already in place, and it was reorganized, rearranged in a way to actually distribute meals to the families and groups that were in most need. There was a distribution of masks. Coordinate the community was very good in terms of like giving access to external resources in coordinated mass tests, facilitate access to health prevention and treatment, and therefore achieved a very sort of low infection rate. That was gained through media attention. They had an image of being a successful community in terms of fighting the pandemic, which gave them access to even more external resources, and at some point governmental attention. So there was, first of all, a previous organization that was already in place. At the moment that the news about the pandemic were already spreading around the world, the favela managed to organize itself even before the Brazilian state did. New practices, and among all the new practices, probably the most interesting that I can describe for you now was the emergence of a movement of what they call street presidents. It means that we have a web of 650 volunteers that were responsible for monitoring the situations of about 50 families. These street presidents were important in terms of disseminating information, fighting the spread of fake news, identifying possible cases, and helping to isolate possible cases as fast as possible. They were bringing their information from those families to the community leaders that were then responsible for allocating resources around the community. And that's proved to be very successful at the very beginning of the pandemic and for a very long case. Unfortunately, the news we had that we had an increase in infection rates in the most recent weeks. But it proved a very successful practice at the beginning of the pandemic. Monitoring results in the favela came through a lot of informal meetings and between community leaders and street presence and sometimes other residents, in which they discussed needs, discussed their own available resources, and discussed the outcomes of the practice that were already in place. So what we see in the case of Paraisópolis, what we have learned about community resilience so far. Community resilience is highly related with previous experience, and that's pretty much what we identified in other places like Hong Kong and Taiwan, which experiences with other kinds of pandemic, and in the case of Paraisópolis, with other social problems and social challenges that were already existing in the pandemic. It was a very robust web of interaction in the favela and tight relations of trust among residents, which allowed for the what we call a web of positive feedback loop around the practices that were emerging. Open communication across the community, that was a very important process. And then what we can know about public policies at this point. I mean, we can think about public policies in terms of interventions in the selecting environments. Public policies can learn a lot about the experiences of community resilience by, one, understanding new practices and think about how different practices can be maybe replicated in other concepts, in other contexts, why we have that in Paraisópolis and not in other communities, and how we can actually replicate successful practices in other communities. And beyond that, public policies can be seen as interventions in the selecting environments. In the case that we know that the practice was successful in initial stage of favela and in the initial stage of the pandemic. At a later stage, public policies could have nurtured and even supporting those practices and maintain those even in when donations and with the select environment in itself was not able to sustain those practices. What is important to know about urban settlements and poor neighborhoods is that the very idea of normal has to be questioned here. While most of the public discourse in this period is about coming back to normal, a lot of those communities are still looking for their normal and what is actually normal. So it's not so much for those communities going back to normal, but it's a capacity to reinvent itself, renewal, and overcome social challenges. And at that point, the resilience is not so much in the practices themselves, but in the social dynamics that actually allowed for the emergence of such new practices. So I think my time is reaching this end, so I'll be more than glad to answer your questions. Thank you.
Thank you very much. It was very interesting. Is there any question from the audience? We are a little bit behind time, but there should be some time for questions. Please write your questions on the chat. If not, actually, I have a very quick question. It is raising related to your last point, is that all these mechanisms, they are, I assume, depending on the size. So you may be able to observe this as emergent phenomena in small closed societies, but if you scale it up to larger populations, they may fail. Would you have recommendations in this? What can we scale up?
From, you mean, for the local groups to larger communities?
Yes.
Well, yeah. Well, first of all, we're already talking about a large community. We're talking about a community with 70,000 inhabitants. So we're already talking about large numbers. I mean, one interesting thing about Paraisópolis is that it's a member of G10, which is a group of 10 biggest favelas in Brazil. And in many ways, a lot of the practice that they developed are actually copied and imitated by other favelas in Brazil. So I think that at least spreading the word and making such cases more known to the public and other groups where such practice can be replicated can be a way of doing that. But at the end of the day, there is a certain limit of how long those processes can be lasting and sustained over time, because those favelas are like open systems. They are, even if they have like local practices that are successful, they are still interacting with a large community, with an overall system in which, as I said, policy level is highly uncoordinated. And sometimes, at the federal level, the pandemic has even been denied. So in that case, there's a limit of how much like local process can actually be sustained over time.
Thank you very much. It was a great talk. We have to move on. I would like to ask the speaker of the third talk to switch on his or her camera because I cannot identify. Great.
Hi. Can you hear me?
Yes, we can. So the next speaker is Valeria D'Andrea, and she's going to talk about epidemic proximity and imitation dynamics drive infodemic waves during the COVID-19 pandemic. You have 5 minutes.
Yeah, I'll try to share my screen now. So, okay, can you see my presentation?
Yes, we can.
Okay, here we go. Okay.
Yeah, the voice is very
there is
low.
no video. I can. So let me just try again. So good morning. No.
Okay. Do you have any other video
I have a YouTube link I can share with you. Okay, for example.
Yes, you can do that as well. Yes.
Oh, okay.
Or you can simply share the YouTube video on your screen because we see your screen actually.
Okay. So just me take the Okay, just me take the link and I'll share again.
All right.
So.
At the same time, I ask, is here the speaker of the last talk? Just to be sure. Okay, okay, good.
Okay, sorry. It's more complicated than I suppose. So let me share the screen again. Sorry for the inconvenience. Right. Can you see my presentation now on YouTube? Yes. Okay, here we go.
Could you make the sound a little bit
higher?
Yes.
If it's possible. Okay.
I don't know how to control the sound output.
I don't know actually. Maybe. I can. This is at the maximum on YouTube, so maybe
at your system level.
I think. Okay, sorry. You cannot hear completely the.
It's very silent.
I put the audio at the maximum actually.
Okay.
But okay. Yeah.
Just send me please the link at the same time. I will try it from my side because it's really very silent.
Okay.
You can send it here in the chat.
Yeah. So I stop sharing this and I share the screen in the chat. Oh, sorry. Here. Okay. Just a little.
Though, so others saying that they can hear it. So maybe we can just go on and maybe it's.
As you prefer. I can.
It's the easiest. So let's go on. Let's not
anyway,
run out of time.
This is the link?
Yes, I got the link.
Okay. What do you prefer?
I can share my screen and then just wait a second. I share my screen. Do you see my screen?
Yeah.
Morning, I am Valeria D'Andrea and I am a postdoc researcher of Comune Lab of Fondazione Bruno Kessler in Trento, and today I'm going to present a work from my lab that's called Epidemic Proximity and Imitation Dynamics Drive Infodemic Waves During the COVID-19 Pandemics. Of course, this is a recorded talk, but I will be online doing the presentation of this talk, so I will be available to answer to your questions. So this work is about infodemic. Infodemic is defined as an overabundance, a huge amount of information from different sources, information that has different level of reliability. Information can be true, but also misleading or even false. Infodemic is accompanying the current COVID-19 pandemic, and it is causing a confusion in the people that cannot well discern true information from the false one, and so potentially leading to harmful behavior and affecting the epidemic diffusion. So infodemic and epidemic are entangled processes, and in this work we will try to understand how those two processes co-evolve, and in particular if we can model infodemic waves using the epidemic waves, the epidemic level intended as the number of COVID-19 cases in each country as a driver of the dynamic. About the data sources, we use Twitter messages collected from the Twitter API. messages with words related to the COVID-19. So, for example, we collected messages with coronavirus or SARS-CoV-2, etc. For this work, we used 180 millions of tweets, but this is a huge project, a wider project from our lab. And up now we collected more than 1 billion of tweets, and these data are available, are public, and you can find them on the dedicated website of our lab. We use geotagged or geolocalized messages to infer the position of the individuals of the user. And we also assess the reliability of the message by filtering messages with that contains URL, and then analyzing the reliability of the sources of the web domain from using a wide set of public database. Epidemic data instead were collected from the website from Oxford University, our wording data. For this work, we use a message is a precise time window between the 7th of February and the 27th of March, because in that time window we have the onset of both epidemic and infodemic waves for a lot of countries. And overall, for this work, we considered 40 different countries. About the model, because of the spreading nature of the infodemic process, we start using a simple epidemic-inspired model, a susceptible infected susceptible model, SIS. And in this case, we assume that the fraction of unreliable news with respect to the total of the news is related to, is equal to the spreader, to the people who spreads misinformation. And that correspond in SIS model to the infected compartment. Instead, the fraction or reliable news is related to the stifler or ignorance about misinformation, and this corresponds in the SIS model to the susceptible compartment. So in this case, the dynamic of the fraction of unreliable news is proportional to both reliable and unreliable, and to the transmission rate from the two compartments. We also considered other two models, but inspired to evolutionary game theory, and in particular to imitation dynamics. The first is the double imitation model, and in this case we assume that the fraction or that individuals could assume could have two different strategies: the strategies of share unreliable news, strategy U, or the strategy of not sharing unreliable news, not sharing misinformation, so the strategy R. And that the shifting between these those two strategies is regulated by the payoff, and that the payoff is proportional to the epidemic level. In particular, the payoff of sharing a piece of misinformation is proportional to the global epidemic, to the worldwide epidemic. Instead, the payoff of not sharing misinformation is related to the local level of epidemic, to the level of, to the number of COVID-19 cases in the considered countries. So we end up with the replicator equation that consider both effects, that do the balance between the perceived payoff and the imitation dynamic. The third model is an extension of the double imitation model. The third model is called the bounded rationality, because in this model we assume that is not a perfect rational choices of the individuals. This model takes in account the stochastic component that we model with a Fermi function. Here I show some results, some examples, in particular from 2 countries. On the left, there are data and dynamics of the model for Italy, and on the right for Brazil. Dotted are the unreliable tweets, the unreliable news in that period, and instead the gray line is the epidemic level of COVID-19. We can appreciate that for example, in Italy, the SIS model does not perform as well as the game theoretical model. And in particular, the game theoretical model are both able to describe well the ascending and descending dynamics of the infodemic waves at the start of the epidemic. We also, of course, evaluated the performance of the model. In this case, for example, we evaluated the epsilon as the normalized root mean square error, normalized to the variance of the data. And we can appreciate that epsilon varies a lot across country. But if we plot the distribution of epsilon altogether, we see that for the double imitation model, epsilon is significantly lower than SIS model, than epidemic model. And we also evaluated the relative performance of the model with by using the archaic weights, and in particular because they are related, of course, to the probability that a certain model is the best candidate to explain data. And even in this case, also in this case, we can appreciate and we can see that weights, archaic weights, varies a lot across countries, and also for the distribution, there is not are comparable for both double imitation and SIS model. Instead, the bounded rationality model in this case is penalized by the fact that it uses one parameter more to describe the dynamics. But in the third plot, I show that if we compute the overall weights for all the countries together, we can see that the double imitation model has the highest probability to be the best model to describe data. We also look at the parameter distribution, and in this case we see that for the double imitation model, parameters in this case they are the transmission rate between the 2 compartments are more are closer to the median for the double imitation, and so suggesting a more reliability and higher reliability of this model with respect to the other. And to test this hypothesis, we perform leave one out validation. In this case, so we essentially for each country and for each model, we estimated the parameter and so the dynamics using the 3 models by computing the parameters from the entire dataset except the considered countries. And in this case, we can see that the double imitation model has the lowest epsilon, the lowest normalized root mean square error, and also the distribution for the archaic weights shows that the highest probability is associated with the double imitation. So to conclude, we saw that in this presentation, we saw that the infodemic and epidemic are entangled process, and here we try to take a first step to understand how those two dynamics are related, and in particular how the misinformation, the level of infodemic, is driven by the epidemics. We tested on a huge data set 3 different models, a simple epidemic model and 2 other models inspired to evolutionary game theory, and where the adopted strategies depends on the payoff perceived by individual. And we found that the game theoretic models perform better in the description of this information dynamics in a specific country, and that the payoff in switching strategies are driven by both non-local force, in this case the worldwide level of the epidemics, and local force, in this case the number of COVID-19 cases in a particular country. Thanks all, and I will be available for questions.
Thank you very much, Valeria. I'm afraid we have no time for questions because we are 5 minutes late. If you have questions for Valeria, please contact her directly through email, I assume, or here in the chat. And then we have to move on to our last talk. I'd like to ask the speaker of the last talk to become visible. Hello. Hi. Okay, so we can hear you. The last talk is about data-driven modeling of public risk perception and emotion on Twitter during the COVID-19 pandemic by Blaž Kolic.
That's me.
Please share your screen. Yes, here we go.
Yeah. Can you see my presentation?
Yes, we see, we hear it. Everything is perfect. You have 12 minutes.
Perfect. So, well, hello, everyone. I think this talk will build a little bit on Valeria's because I'm going to talk about the emotions and the risk perception on Twitter and social media during the current pandemic. It's a work that me, Blaž, and my colleague Joel Dyer from the Complexity Economics Group in INET Oxford have done in this year. And I want to start this presentation asking you guys, how have you felt this year? No? I'm gonna show a quick recap of what's been happening in terms of the COVID daily cases in the UK. When I want to focus in the first peak, which is the time window of our work, in which, if you remember, try to remember how you felt during March, for instance, where there was an exponential growth of the COVID deaths. Then how did you feel when we were flattening the curve and we were in the peak? And then how did you feel in the decay phase all through May and June? And then at the end of June, start of July, it started to look as we were stabilizing, but now we know that we didn't, and we have a second peak right now. So the goal of this presentation is to ask that exact same question to how have people using social media felt this year. So that's the main goal of this presentation. We're gonna soon have a paper published in Applied Network Science, and basically it uses a big Twitter data set. So first we're gonna describe this data set, the methods that we use to process these tweets, and then we're gonna talk a little bit about psychological theories and how we approach these messages. So basically, we have two sources of data. First, official COVID data from our World in Data from Rosler and collaborators, which has the COVID cases and deaths and so on. And on the other hand, we have a big Twitter data set maintained by Banda et al., which we disentangled in 12 countries, 2 languages, and approximately 20 million tweets. And basically, it covers the first peak of the epidemic, which is from March to June. The queries of the dataset are the most generic as possible, so the dataset is as unbiased as it can be. All tweets are original, so we don't include retweets for NLP purposes. And basically what we do is that for every tweet, we inquire the linguistic content of that tweet, basically using a dictionary made by psychologists, Pennebaker and other people. which has different linguistic categories. A category can be death-related discourse, affective processes, anxiety-related discourse, and so on. And basically, this is an intensive variable, meaning that it doesn't scale with the frequency of tweets per day. It's basically the intersection of words in a category with the words in a tweet D. And it's scaled, so it's between 0 and 100. And what we do is to compute the daily national linguistic score. Basically, what we do is we average every tweet in a given country in a given day, and then we normalize it by a Twitter base rate for that category, given in the same reference of this dictionary. And with that, we can construct a time series of different linguistic categories. So I want you to see this panel plot over here, in which we have in each panel different linguistic categories. For in the y-axis, the national linguistic score, and in the x-axis, time from March to the end of June. And I want you to focus in two main panels. First, there's a death panel right here, where you can see a rising death discourse throughout the pandemic. And on the other hand, we have, for most of the affective processes, a decaying emotional response. So that made us question, okay, what's happening? People are talking more about deaths, but at the same time, their emotional response to that is decaying over time. This panel here, it's the aggregation of all these sub panels that I put here in lighter red. So that made us question, okay, what have psychologists told about this? And it results that there's a term called psychophysical numbing, introduced in the 80s and then developed by many people like Paul Slovic and Pedersen Holland, which is basically saying that there's a growing indifference towards human suffering as the number of humans that are suffering increases. Okay, and that's what we explore in this paper. And basically, Paul Slovic in 2010 says that two of the main components of this perception of threats are, in the one hand, the emotional response to those threats and the attention we put to those threats as the threat gets bigger and bigger. So that's basically how we're going to divide our presentation. In one hand, emotion, and the other hand, attention. So in the emotion side, we will present how have affective processes changed during the COVID pandemic, based on this panel plot that I showed you at the beginning. Basically, what we do to address this is to construct word co-occurrence networks in which nodes are words linked by co-occurrence in the same tweet. In the subset of the death and affective process linguistic categories that I showed you earlier. This has been done, for example, to build emotional profiles of Twitter users in the current pandemic by Stella. So it has been successful in some cases. And what I'll show you next is here you can see three snapshots of these networks aggregated throughout all the countries. We have 12 countries here in three different time periods. One from March to April in the rising phase, then from April to May in the peak phase, and then from May to June in the decaying phase. And I want you to see two things. First, the labels of the nodes are colored in green if they belong to the death category, or in red if they belong to the affect category. And you can see a clear separation between these two clusters, where in the left cluster you can see the death-related discourse mainly, and in the right one the affect-related discourse. So this in the one hand. In the other hand, we can see that over time the relative sizes of the cluster change within each other. The death cluster is growing over time, saying that there's like more attention to the deaths in the Twitter conversation, while at the same time the affect, the size of the affect cluster is decreasing over time, meaning that there's like a separation to emotional processes. But this is only qualitative. We wanted to make this quantitative in some way, and to do so, we made a higher fine-grained per country network snapshots of approximately 3 days each with comparable features, the similar number of nodes, similar number of edges, similar total strength of the network. These are weighted networks. And with this, we wanted to construct time series indicators with network measures. And we did so with two indicators. A global indicator, which is the weighted modularity, with the partition induced by the death and the affect categories. Is the same formula as the normal modularity, but all the quantities are for weighted networks and the weighted adjacency matrix. And this measures the emotional separation from the death discourse. A higher modularity means a higher separation from emotions. And a more local measure, which is we take the main word from the death discourse, which is the word death and other declinations, and we measure the total fraction of strength of the word death. It means that a value of 0 means that the neighbors are all in the affect category, and a value of 1 means that are all in the death category. So also a higher value means an emotional detachment from the word death. And what we saw is that, well, what we did is correlate these measures with the logarithm of daily COVID deaths. And at the same time, we compared these results with a baseline null model, which is the weighted configuration model described by Britain in 2011. And what we saw is the following. This is the main results summarized. Basically, here in this correlation table, you can see the correlation for all countries. First row is the correlation with modularity. Second row, null counterpart, and the same thing with the fraction of death. And I want you to focus in the average. Basically, we see two things. We see one, a significant positive correlation with emotional detachment with the COVID deaths cases. And second, we see a much higher correlation from the empirical networks to the null model counterpart. So this says that the empirical network has a structure that actually is detaching from the emotional processes, which supports the hypothesis of psychophysical numbing from the emotional side. And on the other hand, so this is first part. Second part, on the other hand, we have attention, in which we question how has the death-related discourse evolved with the COVID pandemic and its progression. And basically, to do so, we take the death national linguistic score, the panel plot that we showed you at the beginning, as a proxy for the attention to COVID-19 causalities. And then we compare this linguistic score with the daily COVID-19 deaths data. And basically what we saw and what inspired us to try to model this afterwards and look for psychological theories is the following panel plot. When we plotted the set score is just normalizing the time series, so they have the same mean and standard deviation. We saw that when we plotted the logarithm of the daily deaths or daily cases in orange and green respectively, compared to the death-related discourse, we have a really nice correspondence for many of the countries, especially when you compare blue with orange between one another. For example, look at Canada. When Canada rises in cases, the discourse is rising, and when Canada falls, the discourse is falling, and so on with most of the countries, with a couple of exceptions that we can discuss later. But this, for us, was remarkable, and tried to make some regressions out of this. And basically, what we saw is that there are a lot of theories from psychophysics which actually relate a stimula with a perception of that stimuli. And while that is for the individuals in general, here we wanted to apply for the Twitter kind of national linguistic score, where we treat the daily COVID cases, daily COVID deaths as the stimula, and its perception is the national linguistic score. And we had two main approaches. One is the Weber-Fechner's law, which is a logarithmic relation between the two. The perception is a logarithm of the stimula, and a power law where the perception is some power law of the stimula. Note that if beta, the exponent, is less than 1, we have a numbing effect, giving in that it is sublinear relation between between perception and stimuli. Actually, Summers and others found a beta of around 0.32 for experiments of perception of death statistics. So we wanted to make these regressions, and I'm not going to go into the details, but just into the main results. And I want to draw you into the mean values. Here we show the normalized root mean square error, and we have the power law and the Weber-Fechner's law compared to a linear relationship between the two. And we can see in the mean values that these two models are consistently better than a linear relationship, but similar between the two. So this means that there's a sublinear kind of effect on the attention driven to COVID. So basically, we summarize this saying that both the Weber-Fechner's law, the logarithmic relation, and the power law relation are good models of COVID-19 death perceptions. In the power law in particular, we found values between 0.09 and 0.36, which 1 are lower than 1, and 2 are related to the actual experimental values obtained by the Summers. And this also gives us evidence of psychophysical numbing in attention processes. So just to finish off, we're gonna discuss and summarize our results. First, we show that national linguistic scores driven by psychological categories show strong linguistic trends for these psychological categories in all of the countries. Second, we have quantitative evidence of psychophysical numbing given emotional processes and attention processes using network analysis and regression models. These results support psychophysical theories of risk perception. And but now for further work, we have now second peaks in many countries. So we want to either analyze and predict perception in these second peaks with the Twitter data of this second period, and also incorporate other indicators. Here we only use the daily deaths data to model everything, but we want to incorporate mobility, stringency from the government, and also national death statistics for different countries. So I think I'm a little bit out of time, but I'm happy to take questions if there's time, and invite you to read our paper if you're interested. Many thanks.
Thank you very much, Blas. That's very interesting. Is there anyone with a question?
Can I have a small question?
Sure. How? Please go on.
So I would like to, I'm curious, how did you separated your observation period? Is it based on some kind of a criteria?
We were doing this work back in June. So we took all the tweets up to present time, and it coincided with the end of the first peak. So we thought that was a good cutting point. So we basically captured, because there was a big synchronization in the end of the first peak, at least in Europe. Mm-hmm. And we took that as a cutting point, and from there we did all the analysis.
Oh, okay, so it's based on the number of the death.
Yeah, exactly.
Oh, okay, thank you.
Any other question?
Yeah, I guess I'm just wondering about
just a second before we go on to the, okay, all right, that's what I want, the archive link. Please ask your question.
Yeah, I was just worrying about the inference, I suppose, about the emotional dulling. So lots of things happen that co-vary with the death rates. I suppose it was a very uncertain time, and people didn't really know even what the real prevalence was of the disease, so how far it had gone through different populations, but also the death rate was actually quite uncertain, and that changed with time, probably along with the death rate. So I'm just wondering if you've thought about how you might integrate that, I suppose, into your second wave analysis. Might be quite informative.
Yeah, definitely. That's something we're really interested at, because there was a lot of uncertainty in the first wave. And I think that has driven a lot of the emotional response that we saw at the beginning. Actually, there are studies that say that uncertainty has more emotional effects on people. So we want to see in this second wave if this kind of behavior also holds for the same kind of shape of the death statistics. So, but yeah, that's definitely something, because information has changed, and we will now approach the second wave in a different kind of way. right? It's not something as new as before. So
Yeah.
that's what we want to do in the second. But yeah, thanks.
Okay, thanks.
Any other question? If not, please, if you have questions, please just direct it to the speaker through email or here in the chat. And I would like to thank all the speakers. It was a great session. And I think I let you back to the original, to the conference because we are very late, but I think it worth that we run 10 minutes late. So thank you very much again. And see you around at the conference. Thank you.
Yes. Ciao.
Goodbye for everyone. Enjoy the conference. Bye-bye.